As long as it's still fun, not a job, I'll continue. When it becomes a job, that's when I retire.
Yeah. So, Dr. Edward G. Stiles, thank you very much for coming to Berlin and the International Conference of the Osteopathie Schule Deutschland. It is obviously a great honor for us to have you come here and both give a talk and present some workshops to European osteopaths and osteopathic physicians. I'm sure we're going to have a lot of fun over the next few days. Yeah. But what I'd like you to do now is to have a little conversation on or with you about you and your osteopathic life, so to speak. Mm-hmm. And where I would like to start this conversation is actually by going back in time and asking you, what made you become an osteopathic physician?
That's an interesting story, because I never thought I wanted to be a physician, because I thought physicians were right or smart. And I just never thought I'd be able to do something like that. And I went through college, a small liberal arts college in Maine, had a degree in organic chemistry. And had no idea what I wanted to do, but I knew I didn't want to do graduate work in chemistry. And this was 1960, so I took a job with Pfizer Laboratories, calling on doctors and pharmacists and hospitals and things, selling Pfizer's pharmaceuticals. And my territory was in Maine. I grew up in Connecticut. And in Connecticut, DOs had a limited license at that time. They could do manipulation, but they couldn't write for aspirin. And I was a competitive swimmer in high school. In my senior year, I hurt my back. And those days, you didn't have muscle relaxants or anti-inflammatories other than aspirin. So they gave you phenobarb to sedate you and put you in, heat and things like that. And I was getting nowhere. And I was frustrated in my senior year. And I'd been swimming for 4 years, and now I can't swim. And my parents said, let's take you down to Jack Field. He was a friend of their family who was a DO. And he treated me a couple of times, and I was back swimming. And I didn't know the difference. I thought he was a chiropractor or something. But I knew he helped me. So then I go to work for Pfizer. And in Maine, I had a lot of DO family docs and surgeons and internists. And I had, I think, 4 DO hospitals in my territory. And I went, wow, what's this all about? And then a lot of the MDs started saying to me, hey, well, why don't you think about going back to medicine and go back to medical school? And I said, well, I never took pre-med. I got a degree in organic, but I didn't do the physiology and the anatomy and all that stuff. And they said, oh, no, you ought to consider doing it. So I decided that after sitting in doctors' offices and hearing people complain about back pain in MD's offices and not getting good relief, then sitting in DO's offices and hear patients rave about what OMT had done, and decided, yeah, I'm going back. And I thought, if these birds did it, I can do it. I'm going back. And but I thought, if I'm going to be a primary care doc that sees people with back pain, I need to know the osteopathic stuff. So I'm going to osteopathic school. And so that's how I kind of got in the back door.
Yeah, and then you went from the East Coast, from Connecticut to Kirksville, Missouri.
Kirksville, Missouri.
Yeah, and you enrolled in the early 1960s.
I started school in 61.
Yeah. So, what are your first memories from being a student at KCOM?
That it wasn't even KCOM then. It was the Kirksville College of Osteopathy and Surgery, and it was interesting because. And that was when the California merger was taking place. And they were coming in to us every day and saying, we don't know whether you're going to graduate as MDs or DOs. We don't know if there's going to be an osteopathic profession when you get through it. I'm thinking, did I make the right career choice? And I had several classmates that immediately transferred into medical schools. And I thought, no, I don't want to do that, because if I'm going to be a primary care doc, I'm going to see a lot of musculoskeletal stuff. I'd be better off stay here, and if they do merge, at least I'll have those skills. So it was a scary time being in Kirksville at that time.
I can imagine that. If we all look back at our osteopathic lives, so to speak, we can all pick out different mentors who've had a tremendous influence on who we have become as osteopaths and osteopathic physicians. And as I already mentioned to you, you've been one of my mentors and had a great role in shaping the way I think about osteopathy. And what I'd like to do now is to think about some of the mentors which you have had over the time. And I can specifically remember you having repeatedly mentioned 4 people, which would be Dr. George Andrew Laughlin, it would be Dr. Perrin T. Wilson, Dr. Fred Mitchell Sr., and Dr. Paul Kimberly.
Yeah.
So if we start with your student days back in Kirksville, I know you had exposure to Dr. Laughlin, who was a grandson of Still.
So the first semester at Kirksville, they just taught palpation. And I could not feel what they were talking about. And I was really getting discouraged. I'm beginning to think, man, am I in the right field? Because I can't feel what they're talking about. And there were 4 other classmates in my class who had parents or other relatives that were DOs. And they wanted to learn the manipulation. And we were being frustrated with the way it was being taught at that time. And so we started our own study group. And we went to various people, because you spent time in Kirksville, went to various people like Max Gutensohn and said, hey, we understand you're an internist, but you do some OMT. Would you spend an evening with us and talk to us about how you do this? And several of them did it. And one night, Klaus Roeder, remember that name? Mm-hmm. And he was an amazing internist and one of the first endocrinologists in our profession. And he said, you guys are really interested in this stuff. You need to know George Laughlin. And we said, who's he? And they said, well, you could go through here and never hear his name. He's a real loner. He's probably the best manipulator in the area, but he doesn't have any impact with the school or doesn't teach with the school or anything. And you could go through here and never meet him, but I'll introduce you to him if you want. So that was a life-changing experience because one of the first times with George, I said, I'm concerned because I can't palpate what they're saying. And I said this to him in his office. And he said, come here. And he was treating a patient. And he said, feel right there. He said, those are thoracic vertebrae. Now, when the patient bends forward, those facets should open up. When they extend back, they should close. Now, if they go forward and you feel this thumb right up, that means that side's opening up, but this side isn't. If they extend back, both should close. And if this side bends and rotates, you know it's closing and this side isn't. Well, as soon as I had to determine, are those facets opening or closing, I could feel that. And then after I started doing that, I started saying, oh, is this what an acute one feels like? Is this what a chronic one? Is this what a fibrotic one feels? My palpatory skills skyrocketed. So that had a profound impact on my career because I think if we teach the underlying biomechanics to a student and then just give them a couple things that they have to palpate, then I think you can teach palpation real rapidly and quickly. And then they start coming to you and saying, hey, I'm feeling this. And when I became chair at Pikeville, people said, how many lectures do you give your students on palpation? Because they can palpate like everything. So give them one lecture and one lab. That's all they need to get them going.
So you emphasize understanding of mechanics and you emphasize principles and then let the students work it out themselves.
Yes.
Yeah, which is a more patient-oriented teaching approach rather than procedural.
So then Laughlin was the first one I ever saw that did all indirect techniques. And Kirksville was all high velocity at that time. And, we didn't have the Mitchell diagnostic model about nobody, and they didn't teach Fryet's laws at Kirksville at that time because Denslow, when he graduated, went to Chicago, and he and Fryet had a big knockdown drag out apparently. And when he came back to Kirksville, they forbid Fryet's laws to be taught in Kirksville. So you didn't have the biomechanical thing. Nobody was talking about ribcage mechanics. Nobody was talking about the pelvic mechanics like Mitchell did and everything. So you just popped the painful joint. And now that we know tensegrity and stuff, we understand why lots of times that doesn't work. But then I'm in George's office watching him do this, what I call Ouija board, just gentle, now would say indirect techniques. And he got profound results. And so that was a real paradigm shift for me.
Was it a hard time understanding what he was doing to patients?
Oh, yeah, because he couldn't explain anything. Yeah, also he could, in thinking back on it, he gave me the best explanation. But the problem was he didn't give me the translation. And what he said was, take the doodad where it wants to go and fiddle and diddle. That's all he ever said to me. Well, now we'd say, take it where it wants to go, put it in its positional die, then fiddle and diddle to fine tune to get the joint that you're treating as relaxed as possible and find the appropriate axes if you're dealing with the sacrum. And it was fabulous. Years later, I thanked him tremendously in a way because I thought he really gave me the best explanation. But it took me 27 years to know what that meant. So it was hard because nobody was talking about barriers in those days. Nobody was talking about direct techniques and indirect techniques. Mm-hmm. So.
And then when you graduated, you moved back to the East Coast.
Well, it was very interesting because the head of the OPP department when I started was Ira Rumney, And he was brought in as the Parent T. Wilson Professor of osteopathy on an endowed chair by the Rockefellers. And Romney got all upset with me because I was spending all my time with Laughlin, and he thought I should spend my time with him, and he literally tried to get me kicked out of school. And then what was so fascinating, 3 years later, I take over Wilson's practice, who's paying his salary. And it's amazing how our relationship changed. And we became good friends. But no, it was, I caused a lot of trouble because I spent so much time with Laughlin.
And then taking over Dr. Wilson's practice.
So then I went back to Maine after I graduated, did my internship in Waterville. And then ran a private practice, family practice for about 2 years. And I was getting frustrated in it because in those days you did your own obstetrics, you did your own TNAs, you did your own deliveries and things, and I kept saying to my wife, man, this is crazy because I'm spending a lot of time in my practice writing scripts that there are dozens of people in town that could do that, but I don't have the time to do the OMT, so I'm so busy, and I was really coming at a crossroads, and then I started thinking, well, maybe I ought to do something else. And I started thinking about doing internal medicine. And I talked to Max about doing a residency with him. And then I got in those days, it was a penny postcard. There was no picture on it. And I had never changed my mailing address from the hospital, from my internship, to my office and home. So I had my professional mail going to the hospital, private mail going to my home. And the administrator, one day I walked by his office and he came out and said, hey, Ed, here's a postcard for you. And I looked at it, it's Parent T. Wilson. I thought, what's this all about? And he said, George Laughlin gave me your name, and I've been looking for somebody for 10 years to take over my practice. And would you consider coming to Boston to take over my practice? And I said to my wife, there's no way. I'm not interested in just doing a strictly manipulated practice. I don't want to do that. But he's a legend, and I'll go down and spend the 3 days with him and say thanks, but no thanks. But nah, this is what I want to do. Well, I went down and spent 3 days with him, and he blew me away. And I got home and got off the plane and said to my wife, we need to reconsider. And within 3 months, we sold a house, sold a practice, and moved to Boston to take over Wilson's practice.
So if we talk about Dr. Wilson briefly, from an osteopathic perspective, what is the thing with him you hold in highest regard?
He had unbelievable confidence in what you could do osteopathically. And his professional Bible was Stiles' research and practice. And he constantly was going to that. And after years later, Kimberly told me all sorts of stories about Wilson. And one of the stories was somebody asked her, a lecturer said to him one time, how long do you treat patients? And they were asking, what was your appointment time? But Wilson's answer was, well, I'll give up about 5 minutes after they died. And that was really good. I mean, that's really the way he thought. So he gave me a profound appreciation of what osteopathy could do. And his practice was right in Cambridge, Massachusetts. So it was right across the street from Harvard. And he treated a lot of the Harvard people and MIT people and people from the Mass General and stuff. And he had a tremendous rapport with the medical community in Boston. And to see that and to see how he was, like Paul Dudley White was one of the top cardiologists in the country. He used to refer patients to Wilson. And I said to my wife, I need to go down because there were no OMT residencies in those days. And I said, no way, I'm going to have my own residency. And I can work with him. He said he'd be available to help me as much as I want. And he was 80 years old. And they never had any children. So he said, I want to retire, and I think you can handle my practice. And so for IRS purposes, I'll sell you my practice and my McManus table for $1. So for $1, I bought that. And he was only seeing 6 or 7 patients a day, which I couldn't make a living on that. But he sent out like engraved wedding announcements saying I would take over his practice and I might do things a little differently, but he was confident that I'd be able to help him and to give me a few shots to help him. And so I had to build a practice, but I did. And then 2 years later, when I learned muscle energy and brought muscle energy into that practice just exploded. And then I brought the Laughlin stuff into it because Wilson was all high velocity. And he developed a lot of his own high velocity techniques that I've never seen anybody else do. Like he treated all the thoracic and rib dysfunctions on a lateral line technique. It was amazing. And so I got an appreciation of a whole, and I tried to learn what he was doing. And I got where I could pretty well maintain his patients. But then there were a lot of patients that didn't like the high velocity. And when they found out that I could do gentle stuff, functional, then that opened up the practice. But then I hadn't come to the real realization of what Laughlin was doing then. So my results with functional in those days were pretty hit and miss. Mm-hmm. And but it did help some people. And so after I took the first muscle energy course, Wilson said to me, teach me muscle energy and functional. So in his 80s, I taught him muscle energy and functional.
And did he have a real appreciation for that, moving from a high velocity background?
So he realized there was a place for it.
Mm-hmm.
Yeah.
So when we talk about muscle energy, you were one of the original members in the first teaching groups held by Dr. Fred Mitchell Sr. I think they were organized by Sally Sutton back in those days.
Yep.
And I know from previous conversations with you that those were other turning points in your career in terms of understanding osteopathy.
Well, and again, that was in a way fortuitous because Kimberly told me the story years later. And once I got down to Wilson's practice, he had a complete set of the Academy yearbooks, and I had never seen a set. And so all of a sudden, this is mine. And I'm thinking, wait, what am I doing? I've been in practice 2 years. Been doing general practice, mostly high velocity, some functional, and now I'm taking over this guy's practice. What in the world am I doing? This is crazy. So I started reading everything I could find, and I came across the muscle energy stuff on Mitchell and the pelvis. And I went to him and I said, Dr. Wilson, can you help me with this muscle energy stuff that Fred Mitchell is doing? And he said, no, I can't, because he said, Fred was developing that near the end of my career. And so I didn't bother to learn it. But he said, I would highly recommend you learn it. Well, then when I get to meet Mitchell, and he and Kimberly both told me the same story, that one night the Academy was meeting in New York. And Kimberly and Mitchell were doing a course, and the Board of Trustees was meeting at the same time. And then they'd break and come in for a while, and then they'd go back to their meeting, then they'd come in. And at the end of the day, they came up to Fred and they said, we don't like what you're teaching. And Fred, he was tall and lanky, he had a hair trigger temper. And the way he told me, he said, you guys haven't been in here long enough to know what I'm teaching. And they said, well, you meet us up in the ballroom tonight, and we're going to hash this out. So Kimberly said to Mitchell, knowing he had this hair trigger temper, you let me talk tonight, you sit down and shut up. So they go up, Kimberly does all the negotiating and talking and everything. Mitchell just sat there. And they were getting nowhere. So finally, Mitchell said, can I do one thing? And he examined everybody until he found a left-on-left sacral torsion. Then he said to him, who do you want to treat it? You vote on who you want to treat it. And they voted they wanted Wilson to treat it. And both Paul and Fred said he huffed and puffed, because he didn't understand the mechanics the way Mitchell did, but he was what I would call a tinker. He would keep working with it till he figured out a way to do it. Well, they said he pushed and shoved and heaved and everything, and finally said, I can't get it to go. So Fred demonstrated the technique, the modified Sims technique. And Fred told me, he said, the only person that came up to him after that meeting was Perrin Wilson. And Perrin said to him, Fred, tonight, the student taught the teacher. And I didn't know that history. So then I go to Wilson and say, can you teach me this stuff? And he said, no, but I'd highly recommend you learn it. So years later, I learned the significance of that. But what happened was, he said, no, I can't, but are you going to the AOA convention this year? And I said, yeah, it was going to be in New York City. And he said, if Fred's there, I'll introduce you to him. So Wilson was afraid of flying. He went everywhere by train or by car. And I said, well, I'm flying to New York. I'm not going down by train. I'll meet you there. And I walked into the lobby of the hotel, and there was Dr. Wilson. And he said, there's Fred Mitchell over there. Let me take you over and introduce you to him. So he did. And I said, Dr. Mitchell, I've been reading your articles about the pelvis and muscle energy, and I've got more questions than I've got answers. And if sometime during the convention I could have some time with you, I would really appreciate trying to sort this out. And he said, don't move. And he disappeared. And a few minutes later, he came back with Fred Jr., and I never could remember who the other person was. But he took me up to his room, and 5.5 hours later, I got out. And he treated me. He explained muscle energy to me. He answered my questions. He answered questions I didn't even know to ask. And I was just overwhelmed that he was the first person I ever said, here's what a joint does, here's where you palpate, and if it does this, it means this, and you use this muscle. I mean, it was bing, 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 bing. I had never heard anything like that. So that whole convention, I followed him like a puppy dog, and everywhere he went, because people were saying, Fred, would you treat me and stuff, and I was watching him. And I've jokingly said, if he went into the men's room, I went into the men's room, because I was afraid there'd be another door, he'd get out, and I'd lose him. And I was like a shadow for 3 days. And that would have been like in October, either the end of September, early October is when the AOA convention was in those days. And then in about February, that following February, so 5 or 6 months later, I get a call one day and I hear, Dr. Stiles, are you the one? This is Dr. Mitchell. Are you the Dr. Stiles that spent time with me in New York? And I said, yes. And he said, well, Dr. Sutton's convinced me I need to teach a 5-day course. And that's the only way people are, and it's going to be limited to 6 people. And you showed some real interest in New York. If you want a spot, you got it. And I said, you tell me where and when, I'll be there. And so that's how I got into that. And it was so fortunate because Greenman was in there, Goodrich was in there, so I was the young kid on the block. And I was about 10 years younger than them. And so early in my career to get into that mix, it was just unbelievable. Mm-hmm. And then after he taught that tutorial, then he taught several others. And every time he taught another one, he took one of the 6 of us with him. And so I helped him teach another 2 or 3. And that's where I really learned it, because I heard it over and over and over and over. And then we became really good friends. And I don't know how many trips I took to Chattanooga. I'd call him and say, Fred, I'm having trouble with the ribs, or I'm having trouble. So, come on down, spend 3 days with me. And we'd spend time. So I spent a lot of time with him the next 4 years before he died.
Mm-hmm. One of the things I remember you telling me about Dr. Mitchell Sr. is that it wasn't only about the techniques, but also about sequencing the order of the treatment, which is what he actually really emphasized to make the effectiveness.
He mentioned it in the tutorial, but I think he was so focused because he had been teaching the techniques from a podium standpoint, and they didn't have practice sessions, so nobody was learning it. Mm-hmm. So Sally Sutton said to him, Fred, what you need is a small group and have a lot of hands-on practice time. Then I think people can start to learn that. And so we spent the 5 days doing that. And then on the 6th day, we had to treat some of Dr. Sutton's patients in front of Fred. He wanted to see whether we had learned it. And what was so fascinating when you look at the perspective and think about here, people talking at this conference about muscle energy and stuff. And Friday night, Fred stood up after dinner and he said, I think you people are beginning to learn it. And he said, I made the decision on the plane coming in that if you didn't pick it up, I was never going to talk about muscle energy again. So it came that close to getting lost.
That's interesting.
Which is amazing.
It is really amazing because it's now one of the most widely used methods.
But then the Paul Harvey, the rest of the story type of thing. What's fascinating, everybody goes back to their practices, and Greenman goes back to the Buffalo area to close his practice down, to move to Michigan to help start the new school. And he had got a call, and the guy said, my name is Dr. Gaiman, and I'm an MD from the Netherlands, and I have a daughter that lives in the area. I do manual medicine. I hear you do manual medicine. Can I spend mornings with you? And so Phil said he rode a bike like 18 miles every day to his office and spent time with him. And what do you think Phil's going to teach him? What he just learned the previous week on muscle energy. And this Gaiman said, this stuff is amazing. The best manipulator in Europe is Karl Levitt, but he's a prisoner of the communists. And he needs to know this. And within a month, Gaiman got behind the Iron Curtain and taught it to Levitt. And that's why muscle energy is called the Gaiman-Levitt techniques. Mm-hmm. But so it came that close to getting lost, but within a month it was international.
Yeah.
And I think that to me, that just gives me a chill when I think of that.
It does, because I remember having taken courses with both Levitt and Yanda years ago, that I would use methods like that and call it post-isometric relaxation techniques. And it took actually quite a long time before I understood that they were heavily inspired by muscle energy and the development of muscle energy.
Yeah, but it's not post-isometric. I've got a slide comparing post-isometric because Mitchell, his whole focus was making a specific diagnosis and then using the prime mover to reestablish normal mechanics. Well, that's not post-isometric relaxation. So I think it was different, but you could use a lot of the same language, but Mitchell, he had to have a specific diagnosis, mechanical diagnosis.
Yeah. And you already mentioned quite a few times Paul here, which is basically Dr. Paul Kimberley, who also had a tremendous impact on a lot of people in the osteopathic profession. What are your profound memories of him?
Yeah, because the rest of that story about the meeting they had in New York, in the big knockdown drag out. So a year later, Fred Mitchell called Kimberly, and Mitchell lived in Chattanooga, and Kimberly was in St. Petersburg, Florida. And Paul told me the story, and Fred did, and they both told it the same way. And they said, Fred called him and said, look, there's a mountain resort halfway between here. You meet me there Friday night. And so Friday night they get there, and Mitchell walks into Kimberly and says, a year ago you told me to sit down and shut up. Now you sit down and shut up. And he laid out the whole muscle energy stuff to him, and he said, I don't know how to write it up. And Kimberly stayed up all night and wrote it up, and that's how it was eventually published. So they were close in that all the way back. And Kimberly I learned so much from Kimberly, and everybody raves about the Kimberly manual. And that was Kimberly in 1980. But then he had some cardiac problems and had arrhythmia problems, and that's why he retired from Kirksville and went back to Florida. But then he started teaching with us at Michigan State in the postgraduate CME programs. And I thought he was going to kill me, because we would teach all day, then we'd go out to dinner. Then, I don't know if you were in the Kellogg Center at Michigan State at that time, and you came off the elevators, and there were these round couches in like a lobby area. And he'd say, sit down. And he'd start talking to me. And I mean, he changed my paradigm so many different ways. It was amazing. Like, we were having trouble trying to figure out how to treat the flex dysfunctions at T12. And Fred Jr. came up with a technique that he said, because his dad never did it. And Fred Jr. said, I think I've got a technique to do that. And that was the good news. The bad news was it was 500 steps. And he never taught it the same. He never explained the same. Nobody understood it. And I went to Kimberly and I said, what do you think of Freddie Jr.'s technique? And he said, learn the principles, then get them to work for you. And I said, what are you talking about? And he said, have you ever thought about using type 1 mechanics to reverse the rotation of a type 2 dysfunction, then have them position themselves to go out of neutral into type 2 mechanics, and then there you are to do the muscle energy for a flex dysfunction at T12. And once he started me down that path, I mean, it was profound. Profound. Another night, he said to me, I said, hey, I have some problems with women that have a lot of kyphosis and treating flex dysfunctions in them. And because it's hard to get them into extension and side bend and rotation up against the restricted barrier. He said, have you ever thought about treating them in flexion using type 2 mechanics to reverse the rotation and side bending, then have them go back into extension, then have them make them. And I said, and that works so beautifully. But I think of Kimberly and those guys every day, because it's learning the principles, then getting to work for you. And the classic thing is going to be in my gait workshop here, because that's a classic example of that. Learning a few principles of functional and then how you can apply that to gait just by changing your paradigm a little bit. So I think Mitchell, he was so focused on us learning the techniques. He mentioned sequencing and gave us some case histories and stuff, but he didn't really emphasize it. And I think he knew it was important, but I think he was more focused on the learning the techniques. So then one time when I was down there, he said he had a heart attack, and after he'd been home like 6 weeks or something, and I was talking to him. I was at Waterville, And I was talking to him, and I said, "What's going on?" He said, "Well, I'm feeling pretty good, but I got a lot of tension in my upper back and neck, and there's nobody down here to treat me." And I'm thinking, man, that's the sympathetic vasomotor supply to the coronaries and everything. Man, that I don't like that. So I said, "Fred, if you don't mind, I'll be glad to come down and spend 3 days and treat you." He said, "Fabulous." So I get down there, and he had a home office combination. He raised Tennessee walking horses in a beautiful ranch. And his house, when you looked at it from the street, it looked like a ranch. But when you went around the back, there was a bottom floor. And he had his office in there. And it looked out over a lake up on Lookout Mountain. I mean, it was beautiful. And so he said, while you're here, I got a lot of patients that need to be treated. And you treat them, and I'll just sit in the corner and watch. And I don't know how much he planned that or not. But anyway, I'll never forget, the first woman was low back pain and sciatica. And he would always demonstrate kind of a screen, but he didn't really describe what he was doing. So I had learned functional by mimicking Laughlin. So what am I going to do? I'm going to mimic Mitchell on that screen. And I treated this woman out, and I treated some thoracic stuff and rib cage and some lumbar and some stuff in the pelvis and something in the legs. I thought, man, I've shown the old man I can really do his stuff, And he was just sitting in the corner and watch. And I got all through, and he said to the patient, "Stand up and face me." And she did. And he said, "How do you feel?" And she said, "I don't feel one bit different than I did when I walked in here." And my mouth flew open, and and we had developed a pretty good relationship. I turned to him and said, "So much for your stuff," because everything I did was muscle energy. Mm. And he said, "There was nothing wrong with what you did. You did it in the wrong order." And I said, "What do you mean?" And see, in watching me do the screen, he could see where the area grazed. He said, "You should have gone here first, then here, here. Now, retreater, don't add a technique, don't subtract a technique, but do it in that order." And I did, and then he said to her, "Stand up to face me." He said, "How do you feel?" And she pointed at him, and she said, "Now I feel like I do after you treat me." And I thought, holy mackerel. It's not his techniques that get the result, it's his problem solving. See, and in today's language, I think what he would have said to me was, "In terms of my techniques, you're very competent. In terms of how I practice, you're totally incompetent. You don't have a clue on how I problem solve." So that's when I made a commitment, man, I got to try to figure this out. And that had an effect on my whole career, because I've been trying to, how do you verbalize this and how do you teach it to people? Because I had somebody come up to me the other day and they said, that changed my practice more than anything I've ever learned, learning how to find the key area and sequencing. So, and we never talked about it, because I'm beginning to think, I'll bet you he was sitting there thinking, holy mackerel, these people are learning my techniques, but they're not getting the results I am. Okay. So I think if he'd lived longer, I think he would have stressed more the sequencing stuff.
Yeah, that is one of the things which you have taken on, and I know you've spent decades developing sequencing in osteopathy. And you also introduced, rather than talking about key lesions, you introduced the concept of the area of the greatest restriction, looking for that in your sequencing. Would you say that this is all a result of your experience with your mentors, your clinical practice, as well as your own contribution through research?
Yeah, well, Laughlin screened, but he couldn't explain what he did. Because sometimes he'd go down the back and somebody'd be coming in with headaches, saying, he'd go down and he'd say, "I got to start in the leg." Say, "Why in the leg?" "Well, that's where the doodad is, How are you going to know? Well, you'll eventually get to know that. Another time, people would come in low back pain and he'd screen them out and he'd say, "I got to start in the arm." And so that was my first exposure to that. There was a way of examining people. See, and then Wilson screened, but he couldn't verbalize what he did. And then all of a sudden I see Mitchell done. I think, hey, 3 mentors, they're all doing this. I got to try to figure this out. There's got to be a way that this can be verbalized and explained better for students. Because when you're in the patient sequence, it's so much easier to treat those patients. The findings are consistent. The techniques work better. And I thought, why should students have to go through what I went through? I got to figure out a way of being able to teach this where they can pick it up early in their career. And then I think they don't get as frustrated and they get better results.
Mm-hmm. In terms of students, I know we're getting towards the end of this, and I know that at the age of 80, you're still active in practice and training residents. So I know you're really committed to osteopathy, and we can sort of sense that by your enthusiasm as well. But I'd like to ask you, do you think that we succeed in teaching students how to treat patients, or are we mostly focusing on teaching students procedures?
I think we're focusing on procedures.
Yeah.
See, and to me, one of the geniuses of Still was that he didn't write a technique manual. See, and I think he was basically saying, learn the principles that I'm working on, because your patient's going to be a different size than this patient. You're a different size than I am. But if you learn these principles, then you ought to be able to treat any patient. And if you apply those principles, you'll get the similar results to what I do. So, no, I think it's a serious mistake. We're getting, so we have, and I talk, and see, it was because of my functional, Greenman always used to say to me, and everybody used to say, he does muscle energy differently because he came into it from a functional bag. And Greenman used to say, I came at it from a mechanical thing. So he did it more traditionally the way Mitchell did. But I think I picked up a lot of the fine tuning that Mitchell was doing and saying, hey, this takes the technique to a whole nother level. And when you teach that to me, then you're teaching mastery. And I saw this the other day, well, with the left sacral flexion. I was showing students the other day how I can the book says abduct 30 or 15 degrees and internally rotate the thigh to open up the sacroiliac joint. Well, that's good linear thinking. But as Mitchell in that first course said, some sacrums are shaped like this, some are like this, some are like this, some of the surfaces are like this, some are like this, some are like this. So I was demonstrating as a student, I said, look, if I put them at 15 degrees and internally rotate, that locked up that sacroiliac joint. But if I come out about 45 degrees, that relaxed. And when I externally rotate the leg, man, that thing quiets right down. And then I can fine tune to the middle transverse axis. Then Mitchell was always talking about the vector. And when I did that, the student said, man, I can feel that thing changing. Whereas everybody else, it felt like they were just pushing my pelvis around. Mm-hmm. So I think a lot of it is to learn the principles, but then teach the student how to fine tune it. Then I think you take it to a mastery level rather than just competence.
I know that Still, when he taught the students at the beginning of the American School of Osteopathy, he actually taught the students by bringing them into the clinic, seeing real patients with him. Do you think that in osteopathic education we should introduce the students to patients much earlier to enhance this learning opportunity?
Well, see, in Pikeville, when we started that school, we had them in doctors' offices in their first year. Okay. Half a day a week. Mm-hmm. And no, I think that's crucial. And then you see that there are multiple ways in it. Did you never know Alan Becker?
Yeah, I met him briefly, yeah.
Yeah. Becker, to me, because it in a way answers your question. He told the story one time about, or wrote it in one of the journals, the Academy journals, but saying he came out of his second year at Kirksville, and his father was the dean at Des Moines at that time. And he goes home at Christmas, and he's going to show his father, man, he can really do this manipulative stuff. And he got all through, and his father said, lay down. And he said he treated him and used like 200 techniques he had never seen before. And he said to his father, I've never seen all these techniques. Where did you learn them? And he said, I think you're making them up. And his father said, you're right. But they're all based on the same principles. See, and I think that's what we should be focusing on. Because, well, we're left on left sacral torsion. You modified Sims. One of my first teaching fellows, Charlie Beck, came to me at the first year in osteopathic school, in the first lab on the pelvis, and came up to me and said, I figured out a way of treating the left on left sacral torsion with the patient in the prone position. I said, what are you talking about? I've never heard anybody see that or talk about it or do it. What'd you do? He said, it was all based on the principles you taught me. What are you talking about? And he said, I just abducted and abducted the leg till I got that joint relaxed as anything. Then I put my fingers on either side of the sacrum close to the posterior superior. That'd be the middle transverse axis. And I put traction in the leg till that turned that into the left oblique axis. Then I put my hypothenar eminence on the left ILA and put a pressure up towards the right base and had him breathe. That's beautiful. And here a first-year student took those principles and took that to another level. And I thought, yes, to me, that's osteopathic education.
It is. What is it going to take for us to be able to do that with class sizes of 150 students?
When I was a Pfizer rep, you spend a lot of time in doctors' offices, and I had a little notebook because you read a lot of Reader's Digest and things, and I would write down quotes. And one of my favorite quotes is, "When you think you're in a groove, check, you may be in a rut."
Absolutely.
You know, and then another one was, you know, nobody's always wrong. Even a stop clock is right twice a day. So I think it's just got to be a paradigm shift and saying, hey, we've got to teach them, because one of Greenman's favorite quotes that I like, because we were roommates in that first tutorial, so he dragged me into education. I never thought I'd go into education, but he had two quotes that I loved. He said one was, "The expert's the one that does the basics the best." See, and that's it. If you understand the principles and do a few, man, you can take osteopathy all over the place with a few principles and a few. And the other one was, what makes a DO different is not O&T. It's how they think and how they problem solve. And I think that's it. You know, and and Robert Kane, who's an internist in our profession, I love the way he says it. He said, we got to train students to think osteopathically. And what that means is, no matter what the medical diagnosis is, they should ask themselves, could there be a musculoskeletal component to this? Then screen the patient out, and then your findings, do they correlate with that? If they are, treat them and see what the outcome is. And if it's beneficial, you know who's playing a role. And I think with a couple things like that, we could profoundly change osteopathic education.
Yeah, so minor things for a major shift.
Yes.
Absolutely. Well, I could probably sit here for the next 24 hours talking to you, but both of us have work to do here at the conference. So
I've enjoyed it.
Thank you very much for your time. And thank you for sharing all these stories with us, because I think they've certainly made a profound influence on me and my thinking previously. And
We've got time for one other story.
Absolutely.
I think it's appropriate. No, the other one that really changed my whole perspective on teaching was Kim Kaur. And he was my physiology professor, and I was scared to death of him. I just stayed in the back of the room, hope he didn't know my name, and I got through. And then after I got out, I got to know him real well, because he used to have George Laughlin treat him every Tuesday afternoon. So I got to know Kaur in Laughlin's office as a student, so I had a different perspective of him. And the first time I ever lectured at an AOA meeting was in New Orleans. And Kaur came up to me after the lecture, and he said, I want to take you out to dinner tonight. And my first reaction was, oh my God, he's after my diploma or something. You know, what have I done, man? I must have really messed this thing up. And we found a little French restaurant and had a couple glasses of wine. And he said to me, I think you're going to do a lot of teaching. And he said, I have one question to ask you, and it set the whole stage for my career. And he said, here's the question. How do you see your job as an educator? Is your job to fill vessels or teach principles and light fires? And I said, I think teach principles and light fires. He said, good, because he said, if you think you're an educator and you have to teach them everything they need to know, you'll be totally frustrated and you'll never get it done. But if you teach them a few principles and how to apply those principles and light a fire in them, they'll fill in the missing pieces. And I think that the profession needs to take that attitude in teaching. Absolutely. I think that's probably one of the big missing pieces in the way we think about education today. Yep. So I think that's something for all of us in osteopathic education to aspire to. Yeah. So thank you very much again for sharing that story as well. I enjoyed it. And it's great talking to you, Ed. Okay. Thank you very much. Good to see you.